across Europe, reproduction rates of the coronavirus are rising, meaning the virus is spreading quicker than it was in the months after lockdown ended. Let's speak to the European Commissioner for Health and Food Safety, Stella Kyriakides, who joins us now. Commissioner, thank you for your time. So look, particularly across Western Europe, in Spain, in France, in the United Kingdom as well, we're seeing the daily number of new infections starting to really rise. Why is it, and what strategy should be put in place to stop that happening?
Well, good morning, Rosie. I'd say that we've been seeing a steady increase in the number of confirmed cases of COVID-19 over the last 7 weeks. In some member states, this increase is more than others, and I would say that there are also differences not only between member states, but also within member states. We did, of course, expect an increase with the opening of travel, with the resumption of tourism, with the lifting of lockdown. This was something that we were expecting, and member states have the recommendations we put out in July that the way to contain this is by increased testing, contact tracing, and isolation when it is needed. I think it is vitally important for society, for economy, that we avoid generalized lockdowns.
Which strategies would you say are working? In France, lots of cities have got mandatory mask wearing. In the United Kingdom and England, they're going to limit groups again to meeting up to 6 people or more. Which work?
Well, all these measures work to a different degree in different countries, and member states take the measures that they feel they need according to the number of cases they have. What we need to understand is what we see in terms of numbers is often what was in effect 3 to 4 weeks before. So if you put measures in now, for example, of compulsory wearing of masks, you will see probably an effect if this has worked 3-4 weeks down the line. So we are constantly monitoring the situation. I had a teleconference again on a weekly basis with ECDC, and they are confirming that there is an increase. We knew that the epidemic is still there. The virus is circulating amongst us, and we are monitoring the situation very closely and working with member states. With the resumption of schools, it is, again, another area that we need to follow up very closely. But we need to understand that unless we have successful vaccine and or successful therapeutics, we must continue to take our own personal measures as well, because the virus is still there. The pandemic has not ended.
How do we balance these different competing rights? You talk about schools, but the next big thing that European countries are dealing with will be university starting again. Now, lots of those European health bodies have blamed young people for being responsible for then spreading the virus faster than other age groups. Is it the right decision to send all of those young people off to university?
I don't like using the word blame. I think it's important to understand that after restrictions were lifted in many countries, people felt that they wanted to go back to what they felt was their normal lives. This is not possible. We're going to have to learn to live with the virus and live a new kind of normality, especially young people who have been deprived of their social contacts, of their schools, of their universities, of their social circle. It was, in a sense, expected that they would be the ones that would relax in terms of the measures they've taken more. Each member state takes the decisions on whether to open universities and schools according to their own epidemiological characteristics. But what I would say is that one has to balance what measures you are putting into place with the repercussions on society. For example, we know that children being out of school for a very long time is detrimental to their social and mental health. And I think we need to balance this. And as long as measures and safety measures are put into place, and we have discussed this with ECDC and with member states, they have to try to go back to opening again, but knowing that this will not be as it was before the pandemic. Measures have to be in place. We need to protect the most vulnerable among us. We need to continue keeping our social distances, wearing our masks, and washing our hands, of course, as we have been saying from the beginning.
Commissioner, finally, I just want to ask you, you mentioned the idea of a vaccine. Of course, lots of people eagerly anticipating that to come. If it does, how are you already preparing for the efficient distribution of something across Europe?
We've been working on this for the last 3 months, as you know, through the European strategy on vaccines. I would say that when and if a successful and effective and safe vaccine is available, then member states will be able to put in their orders and we will have a distribution key in place. I believe that we need to understand, this is a message that I would like to send, that even if and when we have a successful vaccine, this does not mean that the situation of this pandemic will be solved the next day. We're going to have to continue to be careful, to take our measures. Countries will need to continue with testing and contact tracing and possibly isolation when needed for a while to come, until we have managed to reach as many people as possible with the vaccine. So COVID-19 is here. It's a virus that is still spreading within the community in many, many countries, and not only within the European Union. And I understand that it has made us learn to live with a new normality, but it is something that we have to adjust to in order to get back to life, a new normal life, and allow societies and economies to be able to move forward.
Thank you very much for your time. European Commissioner for Health and Food Safety, Stella Kyriakides. Really appreciate it.